My name is Dr. Shaibya Saldanha. I'm a gynecologist. A gynecologist inherently is primarily focused on women's health. We say it starts from the womb to the tomb. So continuing through her whole reproductive life, to her adult life, through old age. So gynecologist actually specializes in helping women take care of their own health. So if a patient comes to me, if a woman comes to me with a health issue, the first time I may take 30 to 40 minutes talking to her. So one is a clinical assessment of her health issues, an understanding of where her genetics, her environment, her growing up, all has impacted her life and created the health issues that it has created now. Then I next decide that I have a differential diagnosis of XYZ. For example, so when she came, say, with abdominal pain or period cramps, there may be so many different diagnoses. I have obtained the history. I come to about 3 or 4 differential diagnoses. Then I ask for the investigation. So I will do a certain amount of examination of the person. So my clinical examination further narrows down my diagnosis. Then I will do a certain number of investigations, not anything which is unnecessary. And at the end of it, you get a diagnosis. Then the patient will come back after 3-4 days or a week or 2 weeks, depending on when I've asked her to come back. And in the meanwhile, I may ask her to look at her food and her sleep or her work stresses or her home stresses which are impacting her condition. Then when she comes back, we discuss what are the investigations we've got, and I come to an explanation of my diagnosis. And I explain to her why I feel these are the things which has impacted her and caused this health issue. And then I will give her all the options of treatment which she has. For me, it's important that I give the agency to the family to do what they wish with their health, but explaining to them what are the risks and prognosis. And then I ask the person to think over what are the options they would like to choose of treatment, and then they do that. And then they would come back after 3 months or 6 months, depending on what is the concern. And they will come back and we will re-see where they are and how it is working. And so slowly medical knowledge has to be given into the hand of the patient for them to be able to make the correct decisions for themselves.